Hello, I am Dr. Lorance Peter, consultant gastroenterologist and director of Department of Gastroenterology and Hepatology at Sakra World Hospital, Bangalore. What is inflammatory bowel disease? You must have heard this term many a times, and many people confuse it with irritable bowel syndrome or IBS. That's a different disease. What we are talking today is inflammatory bowel disease or IBD. It's a spectrum of disease characterized by uncontrolled inflammation of the intestine, characterized by ulcer formations, bleeding and loose stools and pain abdomen. So this disease involves the intestine. It causes inflammation, ulcerations and loose stools, and predominantly it affects the younger population, and it is some kind of an autoimmune or autoinflammatory condition. So what exactly causes IBD? It's a difficult question to answer. There are various factors proposed. So one is, some people are genetically predisposed. They have family history of IBD in first degree relatives. They have father and they have some genetic mutations which are predisposed to them. Second is our type of diet, more westernized diet, more processed diet, and diet with preservatives and less antioxidants and natural unprocessed food. These diets are pro-inflammatory. Three, there is definitely a change in our bacterial flora of our intestine. You may be surprised that we carry around 3 to 4 kgs of bacteria in our body, in our intestines. And there's a delicate balance between the good bacteria and the bad bacteria, or anti-inflammatory and pro-inflammatory bacteria. So when this delicate balance is broken down, then our intestine develops some kind of an inflammation. It is not an infection, it's an inflammation or swelling or whatever happens. A lot of inflammation seen on a microscope, which leads to pain, weight loss, loose stools and diarrhea. So this is what called inflammatory bowel disease. So in a short, it is a autoinflammatory condition affecting the intestine, brought on in a genetically predisposed person by change in the lifestyle and diet, and change in the bacterial flora of our intestine.